side of the face is reddish or hot, which remedy comes to your mind? Second, one side of the face basically is painful because of anger. And the remedy which I am talking about, everybody, the remedy which I am talking about is a simple remedy, chamomilla. Now, if you see a chamomilla face, it is very, very important to understand how to get or prescribe a chamomilla patient. Now, I have told you one-sided pale face, one-sided pain in the face because of anger, pain in the face because of excitement. Remember, whenever a chamomilla patient is excited, he has pain in the face. Whenever a chamomilla patient is excited, he has pain in the face. A chamomilla face always will tell you one thing. I had a wonderful case of blood pressure, hypertension. Yeah, hello. I had a wonderful case of hypertension where the patient, whenever there was increase in the blood pressure, he told me, sir, one side of my face becomes numb. वो सुन्न पड़ जाता है. And whenever one side of the face becomes numb, you have to think about chamomilla. So everybody, please come online. Now we had 2-3 hiccups. Now we are through with the YouTube live. You can join in very early. So we are talking about chamomilla. 3 things of chamomilla. Pain in the Doctor, at least you welcome. So chamomilla face, always remember, a chamomilla face basically has pain in the face from drinking warm drinks. Pain in the face by drinking warm drinks. If you have ever seen a chamomilla case, if you have taken a case of chamomilla and the whole case you have taken and you want to confirm that is this a chamomilla case, then you have to ask this question, whether the pain in the face is aggravated from drinking warm. That is chamomilla. Then in chamomilla, one thing you have to remember, when you see a face of chamomilla, it is perspiration. In chamomilla, there is perspiration after drinking. A very, very important symptom of a chamomilla face that everyone should remember. A lot of students ask me, sir, how do you enter the case? You take the case. How do you ask the symptom? I ask this when I am confirmed that my remedies are either chamomilla, senna, merxol, then I differentiate through matermedica. If it is a chamomilla patient, then a chamomilla patient has face pain which is aggravated by warm drink. So I'll ask 3-4 questions of chamomilla regarding face, eyes, ears, nose, anything which is very important to the patient, and then we get to the remedy. In chamomilla, remember, whenever the patient has finished eating, he has perspiration on the face. That's the beauty of chamomilla prescribing. So in chamomilla, it is so important that you understand that chamomilla patient has perspiration on face after eating. Next, a chamomilla patient will always come and tell you, okay, sir, whenever I am eating food, there is difficulty in chewing. I get tired of chewing. But what is the patient trying to tell you? What is the patient trying to tell you? The patient is trying to tell you that there is a weakness of the lower jaw after eating. So my dear friends, if there is weakness of lower jaw after eating, you have to think about chamomilla. I had a lot of slides of face. I had made slide, but today there is a problem again in the internet because lots of work is going on. So I'll be very extempo in whatever I am talking. A chamomilla patient has weakness of the lower jaw after eating. A very, very important symptom of chamomilla. Next, how is the face of forehead of chamomilla? A chamomilla forehead is always like this, my dear friends. What is this called as? What is this called as? Anybody? What is this called? Dr. George, Dr. Mira, what is this? A chamomilla patient will always have a wrinkled forehead. It is a wrinkled forehead that is chamomilla. So this is how you can see the face of the patient and try. Yes, wrinkled forehead. Wrinkled, no, we are talking about forehead. Frown is like this. This is frowning. This is wrinkling. This is contraction. Contracted eyebrows. I'll get to you. I'll get back to you. I'll tell you how to differentiate them. So this is basically a chamomilla. So understand a chamomilla face. If you think your remedy is chamomilla and you have to enter the case through face, think about face pain because of anger, pain in the face because of excitement, numbness in the face, or weakness of the lower jaw after eating. Very, very important symptom. Whenever a patient has perspiration on the face after eating or drinking, my dear friends, look at chamomilla. Is the patient chamomilla? Don't always judge chamomilla by that snappish, anger, irritability. There are a lot of other things how to enter the case, and this will make you a very successful prescriber. This is a typical chamomilla face. I had the face of a lot of patients of chamomilla, but unfortunately I cannot show you today. Maybe in the next YouTube I'll tell you the chamomilla face. Next drug that comes to my mind today is Moschus. And I have cured at least 10 to 11 cases just by this one symptom of Moschus, which I have found very useful only on face. Students keep asking me, sir, whenever you are, how are you so sure of the remedy and how can you predict that I'll give this remedy and this will be cured before the cure? When I prescribe, there has to be some internal feeling that the remedy is right. My dear friends, Moschus. You must have read Moschus that there is a discoloration of the lips when the patient is very angry. The patient keeps scolding. But that I have not seen so much in Moschus face. Does anybody know what is the meaning of Moschus face? Have you ever seen a Moschus face? Yes, anybody? It is a very, very interesting remedy, and you should be able to see that. You have to see that Moschus face. I can imagine that patient in front of me. Moschus patient, Moschus face. A Moschus patient, remember, will do like this. What is this? What is this? What I am doing? You must have a lot of patients doing like this in front of you. What is this? This is how a Moschus. No. This is how, no, haughtiness. Haughtiness is like this. No, this is not haughtiness. Can you go further? Can you go further? This is gestures. No, I am only concentrating today on the face. If the patient does like this, what is he doing actually? The patient of Moschus behaves like this because he feels that the facial muscles are short. So it tries to stretch it to think that they are normal. You understand? So this is how you have to interpret the symptoms. Somebody can take gestures, somebody can take haughtiness, somebody can take wrinkling, somebody can take tics. But that's why we fail in our practice in prescribing. And that's why in Chamomilla it is written that one side of the face of Chamomilla is hot and the other side cold. If the patient is doing like this, just touch the face of the patient. Mind you, don't touch the face of every patient. First see what is the age of the patient, then touch the face, okay? So Moschus patient has general coldness of one side of the face. And then see the lips of the patient. In Corona time, when I ask a lady to please open the face, they feel quite awkward. Why what the doctor wants to see. But if it is a Moschus patient, in Moschus, the lips are always peeling. It is called as peeling lips. The lips will be peeling off, and that is Moschus. He may be a spoiled child. as it is written in a repertory, but these 4 or 5 symptoms of the face I have confirmed in many of my patients, and that has never let me down. That is, facial muscles feel short, one side of the face is hot, general coldness of one side, and peeling lips. Are you with me? Are you understanding what I mean to tell you? Yes or no? Are you understanding? Or I should come one step lower and teach you what is Moschus. Face, prescribing through face. Last time you see prescribing through eyes. Now let us see about face. Yes, Dr. Sadhna, very good. When you see, now you are feeling, how will I be able to judge a face? But just one prescription, just one face, if you have seen in your chamber what I am telling, and one prescription is right, you will get lot of confidence. Lots of doctors now come on WhatsApp, on my Facebook page, on my YouTube, and keep liking that we are happy that your way of teaching is affecting a practice, and it is the practice is growing, and I feel very happy. Because what happens, I have seen in my students that you take the whole case, then you repetize, then you interpret mind symptoms, then the body symptoms. Sometimes interpretation is so difficult in mental cases, it is very difficult, and then the problem starts, isn't so? I had a beautiful case of leukoderma, vitiligo of face. I just prescribed the remedy by just seeing the lips of the patient, and the lips were everted lips. I have the photograph of the patient, but I can't show you because I cannot show the slideshow. There's a problem. Everted lips. A case of leukoderma. For 8 years he had leukoderma, taken all the treatment, but no change. So after a case, he told me, sir, this type of case I have given to about 6 to 7 doctors, but there is no change. So when my students, when my colleagues came to me and sir said, one said, sir, this is because of separation, this is because of grief and sorrow and elements from disappointment. I said, forget everything. What you see on the face, tell me. And he had everted lips. And I asked 2-3 leading questions of the remedy, and I prescribed the remedy. Which remedy comes to your mind? Anybody? Dr. Bangi, Dr. Sadhna, which remedy comes to your mind? Everted lips. Which is the remedy for everted lips? Yes, a beautiful case of leukoderma. Everted lips. Anybody? Everted lips. Any remedy? If you don't know, write no and move further. So I again asked, okay, during headache, the veins of the face are distended. He said, sir, whenever there is headache, my whole, people can see my veins. Yeah, no, people can see my veins. And he also had wrinkled forehead. If you see these 3 symptoms, no, veins distended during headache, wrinkled forehead, everted lips, and the remedy I gave, Syphilinum. Syphilinum 200 single dose, and the leukoderma which was on the lips or here, this 2 patch subsided within a span of 2 months. Only on lips it is left, just by these 3 symptoms: veins distended during headache of the face, everted lips, and wrinkled forehead. This is how, my friends, you have to enter a case. And Syphilinum, write down one symptom in your Matermedic or notes. Always there is eruption on the nose which is red. The patient will look as if a red light is there on the face, signal, red signal. That is Syphilinum. This is the face of Syphilinum. Have you ever heard or seen a face of Syphilinum? This is how you have to enter through face. See, I cannot tell you all the remedies of face from A to Z, but I am just giving you a thought process. Okay, just a thought process, just a different way to approach a case, because sometimes you see a typical face, but you feel this is a symptom or a remedy. Sometimes you don't know how to enter the case. Yes, causticum has veins on the nose. So whatever I am telling you, Dr. Idlisi, is only because of my experience of treating patients. Materia medica wise, I am not telling, I'm just telling you about whatever seen in the case, but I know causticum has that. Let us move on quickly on to another remedy, and that is Bryonia. You see the peeling lips of Moschus. If you have aphthe on the lips, you must think about Bryonia. I had a very interesting case of convulsions, and the patient had like this used to do. What is this called as? What is this called as? I had a video of this patient. This is typically called as chewing motions of the jaw in brain complaints. Chewing motion of the jaw constant. In fact, the mother will tell you with a child that my child always has chewing motion of the jaw during sleep, and that is the remedy is Bryonia alba. Dr. Bangi, very nice. Chewing motion. Have you ever prescribed on these symptoms in your life till now? If not, if you cannot enter the case through the case taking, that please try this symptom and then you can prescribe. In Bryonia, if you have seen that case, it is like this. What is this? What is this, Dr. Bangi? Dr. Sadhna? The patient comes and sit in front of you like this. Sir, I have a lot of headache. Headache is in the sun. What is this? What is doing? How is the face? Anybody? So this is how a Bryonia lip will appear. No, I am not telling like this. This is biting. I am not doing that. I am doing like this. This is called as the patient draws the lower lip. He draws the lower lip inside, and that's a Bryonia case. That's a Bryonia case. If you want to confirm a Bryonia case, you see the eruptions on the face of Bryonia. How is the eruption of face of Bryonia? They are very horny. Horny eruptions give Bryonia. I have seen sometimes in case taking, lots of effort has been done. You can't get a remedy. See the face, eruptions are there, horny, give Bryonia. Because I have told, give Bryonia and see the miracle of homeopathy. This is how you have to understand. That's why if you understand Bryonia lips, a Bryonia patient lips will always have hemorrhage on the lower lips. Lower lips. He'll always have itching of the lower lip. Like this. Have you seen patients sometime? They come and sit in clinic like this, like this. Have you seen that patients? Itching of the lower lip. Hemorrhage of the lower lip. Draws the lower lip inside. This is Bryonia. And a Bryonia patient, remember one thing. A very, very important remedy for burning in the lips, especially in which type of personalities, anybody, especially in whom? Burning in the lips. Which type of persons you will get burning of the lips? And Bryonia is indicated in that complaints. Close your eyes, give the remedy and watch the miracle. That is how a Bryonia has burning pain. But in which persons? Is anybody? Bryonia has Burning in the lips. In which persons? Whom? Anybody? A Bryonia patient has burning in the lips, especially in smokers. So if a smoker is there, he's complaining of burning in the lips, think about Bryonia. Understand? So this is a Bryonia type of face. As far as the expressions of the face of the patient is thought, a Bryonia can have expressions like idiotic, old looking, sickly. All these type of expressions are of Bryonia patients. I hope you are getting what I mean to tell you. Everybody. I hope everybody is getting what I mean. I hope you're with me. Or it appears too boring, or it appears too much for you. Yeah, Dr. Devesha. So this is what I have seen in Bryonia face. So if you see this type of face, or please do think about Bryonia. Now let us quickly go into other remedy. I'll just tell you the expression of that remedy. The remedy will have these expressions. Just tell me. What is this expression? This is called what type of... Have you ever seen a case in front of you like this type of expression? This is how you have to see the patients. In that remedy, I'll give you... we are telling just face of the patient. I'll give you one more clue. Whenever that patient gets angry, the face becomes pale. The face becomes pale. Whenever the patient becomes angry, the face becomes pale, which is that remedy or expression like this. This type of expressions also. All these three are basically that remedy. Which is that remedy? Or the patient will have like this. He'll keep in this like this in front of you. And the skin around the mouth, if you see, is very rough. The whole cheeks are very soft. The forehead is soft. Around the mouth, it is very, very rough. Which is the remedy I am talking about? Anybody, can you guess? The face. When any patient that comes in front of you, first see the face. That will tell you lot many things. Have you judged the face? Which remedy I am talking about? Yes, my dear friends, which remedy I am talking about? Yes, anybody? Anybody? So this remedy which I am talking about is a very, very Bratakarm. No. So see, I'll tell you. The problem in homeopathy starts where you have some prejudiced mind that I told you about the eyes, the heaviness of the eyes, 5-6 remedies, and everybody had one answer, gelsemium. This also expression is childish. Expression is vacant. Itching around the mouth, roughness around the mouth. But when the patient becomes angry, maniacal, rage, the face becomes discolored and pale. And the remedy is not Bratakarm, it is Anacardium. Anacardium is a very, very important remedy when the skin around the mouth, is very rough, itching of the skin around the mouth, expressions are vacant and childish, and discoloration of the face is pale because of anger. Have you seen Anacardium? Please go and read Anacardium. And the patient of Anacardium also has one thing, and that is warts on the eyebrows. I had lots of cases referred to me, warts on the eyebrows. lots of Watts medicine given, but no change. Anacardium has a very, very important symptom, warts on the eyebrows, and anacardium will definitely heal the case. In fact, I prescribed anacardium in a case where there was suppuration of boil on the chin. There was recurrent boils, pus, taking a lot of antibiotics, taking a lot of homeopathy, but no change. When I was reading anacardium face, it is very well written in the Mater Medica, suppuration of chin from old boils. And then anacardium, I read about anacardium and I was very much happy to give anacardium, and that cured the complaints. This is how, my dear friends, you have to enter the case just by seeing the face of the patient. Are you with me? Are you with me? Once again, I would like to add in anacardium, because I don't think you must have read about anacardium. Anacardium. When the anacardium patient sleeps, ask her mother, ask the father, ask the accompanying personality who sleeps with him, anacardium patient, if you want to confirm, see his face. It's like this. I had to practice to teach anacardium to my students about this. Can you do like this? One lip. What is this? This is twisting around the mouth during sleep, and a very important remedy, that is anacardium. So my dear friends, whenever anacardium face comes in front of you, make sure that you prescribe anacardium just by seeing these 3-4 symptoms or 4-5 symptoms. The most important symptom, the paleness of face because of anger, the vacant look, the childish look, the roughness around the mouth, itching around the mouth, the suppuration in the chin, recurrent boils, and that is anacardium. It is already 5:20. I'll just take one more remedy, a rare remedy that recently I have prescribed in a case of arthritis. I hope everybody is enjoying as much as I am enjoying teaching you. I enjoy teaching this type of stuff because it is very individualistic in part of me. I like teaching these approaches because a lot of students have difficulty in how to enter the case, and I always tell them, if you can't enter the case through the whole case taking, don't worry, enter. There are a lot of other things to enter. Okay. So let me tell you one quick remedy, and then maybe I'll stop this. I think Dr. Sadhna is happy, I think. Yeah, so one remedy, I'll tell you one thing. Okay. A patient comes to you and says whenever he gets up in the morning, he has pain in the face. He has pain in the face and so much pain in the eyebrows that he cannot touch the eyebrows in the morning. And whenever he starts walking, there is perspiration on the face. I cured a wonderful case of arthritis by this remedy, by this symptom add-on with the other case taking. Which is the remedy? And because of too much pain, too much chronicity of the complaints, the patient was fed up. And the expression on the face of the patient was old looking. So we have about 4 to 5 symptoms in front of us. Perspiration while walking, pain in the face rising in the morning, sore pain in the eyebrows, and old looking face. Which remedy comes to your mind? Which remedy comes to your mind? In fact, then I asked the patient, if you walk in air, in open air, then you don't perspire? And his answer was, sir, when I do walking in open air also, there is perspiration on the face. Which is the remedy? Anybody? Which remedy comes to your mind? Very, very important remedy. Very, very important remedy that you should always remember. Perspiration on the face while walking in open air also, pain in the face while walking, rising in the morning, sore blue spell in the eyebrows, and old looking expression. Which remedy comes to your mind? Anybody? Dr. Bangi is very fast and she wrote she does not know. Anybody, can you guess? So the remedy which I prescribed was Guaiacum. Guaiacum. Dr. Adli said it was Guaiacum. Guaiacum. Guaiacum 200 single dose and the patient started improving. I repeated after 15 days, then after a month, then again after a month, and within 6 months time I could cure the arthritis. Of course, I saw the symptoms also of Guaiacum, but these symptoms were so very particular about Guaiacum that I was surprised to see the face symptoms of Guaiacum and prescribe Guaiacum, which gave me very good results in the case of arthritis. So this is, my friends, in short about entering through face. I know half an hour is not okay. So half an hour basically is very little time for this type of talks, but next time also I'll take about face only because I could not show the faces today. So if you have enjoyed it, please do join me on next Saturday YouTube live 4:30 to 5. In between 4 to 5 Facebook live on every Wednesday, question answer sessions. In that also you can ask me some questions about face, eyes, ears, nose. I'll be happy to answer. You can ask me anything, whatever I have seen in my practice, I'll be able to tell you. I hope you enjoyed. I hope everybody enjoyed what I wanted to share with you. Yes, anybody? Okay, Dr. Bangi has heard Guaiacum for the first time. No, it's a very common, it's basically a remedy which is very common in prescription arthritis because it's a pain remedy. Yeah, so Dr. Meera, thank you, and thank you everybody for joining, and sorry for the internet connections. That's why we could start about 5-10 minutes late. But I hope you enjoyed, and please do share with your friends so that next time they are prepared in what I want to tell you. Next time again, I'll repeat the face, some more drugs which I have seen in my practice. Till then, bye and thank you.